everyone, it's Angela from the Clerks Department. We're just going to run a sound check. So sound check presenter's laptop, sound check presenter's laptop, sound check clerk's laptop, sound check clerk's laptop.
Okay. Good morning, councillors. We are now live. Can everyone hear me okay? Excellent. I'd like to call the meeting to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. As well, a reminder that all electronic devices are switched to a non-audible function during the committee meetings. Members are reminded of the 5-minute time limit, which will be adhered to during this meeting. Members can submit another request to speak if they require more time to ask questions or to make comments. I'll now commence the roll call. Please indicate your presence when I call your name. Mayor Eisenberger?
Present, sir, very present, and just to advise, at about 10:30, I have to step away for about 10 or 15 minutes.
Much appreciated, sir, and good morning. Councillor Wilson, please. She was there. Councillor Farr?
Good morning.
Good morning, sir. Councillor Nan? Councillor Marula?
Good morning, Mr. Deputy Mayor and
Good
President.
morning. Thank you. Councillor Collins? Councillor Jackson?
An old-fashioned here.
From Toggling Tommy. Good morning, sir. Councillor Pauls?
Good morning.
Good morning. Councillor Danko?
Good morning, Present.
Good morning. Councillor Pearson?
Good morning, Present.
Good morning. I hear the exasperation. Councillor Johnson?
How do I top that? Good morning.
Councillor Ferguson? He's here. Good morning, sir. Councillor Vanderbeek?
I'm here. Thank you. Good morning.
Good morning. Councillor Whitehead? And finally, Councillor Partridge?
Good morning, Deputy Mayor. I'm here. Thank you.
Good morning. Approval of the agenda. Madam Clerk, are there any changes to the agenda?
Yes, through you, Mr. Deputy Mayor, we do have changes. The addition of the January 27th minutes, as well item 8.2, the review of the utilization and performance of the city facilities and assets has been removed from today's agenda. The council will bring it forward at a later date when she's ready.
Thank you very much. May I have a mover and a seconder to approve the agenda as amended, moved by Councillor Pearson, seconded by Councillor Vanderbeek. Any questions or comments about the agenda? Seeing none, we'll go to the vote, please. Votes up. Yeah, Councillor Farr is here. And the vote carried 14-0. Thank you. Declarations of interest. Members of the committee, are there any declarations of interest this morning? Seeing none, we'll move on to item 3.1, which is the approval of the minutes of January 27th, 2021. May I have a mover and a seconder to approve the minutes? Moved by Councillor Partridge, seconded by Councillor Pauls. Is there any discussion regarding the minutes? Seeing none, Madam Clerk, we'll go to the vote, please. Up. The vote is now closed and it carried 14-0. Presentations, item 6.1 on today's agenda is the Healthy and Safe Communities Department 2021 operating budget. Madam Clerk.
Oh, through you, Mr. Deputy Mayor, my apologies. I did miss adding something to your roadmap last night. Correspondence from Denise Arkell, which is item 4.1, the Executive Director of Neighbor to Neighbor, respecting the funding proposal for Neighbor to Neighbor, and the recommendation is be received and referred to consideration of item 8.1.
So I need a mover and a seconder for that item. Moved by Councillor Danko, seconded by Councillor Pearson. Any comments or questions on that? Seeing none, we'll have the vote. Thank you, Madam Clerk, for catching that. Councillor Ferguson, is a vote up? Thank you. And that carried 14-0. Thank you very much. We'll move on to 6.1. Mr. Paul Johnson, General Manager of the Healthy and Safe Communities Department, will provide the presentation for 6.1. Are you there, Mr. Johnson?
I am. And through the Deputy Mayor, good morning, Mr. Mayor, members of Council. It's my pleasure to be with you today to deliver our departmental budget, which I'll share my screen in just 1 second. You'll notice I'm standing. I've set up my computer so I can actually stand. Normally we deliver these at the podium and in the horseshoe and council chamber. And yes, I am so fed up with the pandemic. I actually am missing standing at the podium at City Hall and council chamber. So here we go.
I'm only laughing because we only see the top half of you anyways, Paul.
Exactly. And
so we don't really know what's going on at the other end.
Let me put it this way. Just someone warn me if I'm starting to move away from the camera because we don't want that to happen.
Okay. Thank you. Go ahead, Paul.
All joking aside, through the Deputy Mayor, it's a real pleasure for me to be here today and walk you through our budget presentation. As I've done in previous years, this presentation will be structured in the following way. First, I will take you through some of the numbers in the actual budget. This is our budget presentation. So I'll begin with an overview of the finances of our department and also the net levy increase that is proposed in the budget book that you received. And I have good news this morning that actually that number has been revised with a series of things happening since that budget book was released. Then I'm going to move through a discussion of 2020 in review, the year that it was. And, you know, sometimes we often use that phrase, it was a year like no other. Generally, that's when we have a major project or something happens from a policy change perspective. I'll never use that phrase again in the same way. 2020 definitely was a year like no other. So when we look at the Healthy and Safe Communities Department for 2021, we are a department with an operating budget of just over $660 million. As you're well aware, a large chunk of that comes from investments from the provincial government. We deliver a number of programs in concert and in a cost-sharing agreement with the provincial government. And so $323 million of our budget is made up by provincial investments into community programming, and that runs throughout most of the things that our department delivers. We do receive some money on an annual basis from the federal government, and then, of course, we do raise some fees. 2021, we're projecting those fees to be a little bit lower, obviously in recreation, but also through our long-term care division. Those are the two largest areas where fees are generated across our department. When you look at all of the numbers, it boils down to, in the budget book, proposed 3.7% net levy increase, and that is on the $257 million proposed levy piece. But I do have some information that will revise that number as we move along. So this is the same information provided for you in a pie chart, simply showing where the resources come from that make up the $663 million proposed 2021 budget. When we shift to the net levy budget, which is obviously the major source of our conversation today, that $257 million is broken up in a variety of different ways through the divisions of our department. And I think most people in the community recognize that one of the largest net levy contributions that is made to our department is for our fire department. It is a municipal service, and it is at just under $95 million, a significant investment for the safety of our community. I think what is less well known is that the second largest investment of net levy resources to our department is actually to housing services at just under $47 million. While the province of Ontario and the federal government are both contributors to our work in affordable housing and homelessness, the municipality, both through its cost-sharing agreement with the province, but also through additional investments that you make each year, is contributing a significant amount to ensuring that we can maintain our stock of social and affordable housing, provide homeless services in our community, and ensure that we're looking at new and unique ways to deal with the crisis of homelessness and affordable housing. And then, of course, the third largest area of net levy contribution is in recreation. And that's, again, typical across municipalities as a locally run program. And we have so many great recreation facilities and programs, as you well know. So when we look at our department, we sit here with a group of people who this year I want to spend just a few minutes and thank in front of you and in front of the public for the work that they do each and every day for as long as I've known them, but in particular focus in on the incredible job that they've been doing in the last 12 months. This leadership team that you see on this chart, this is the group that support each other, that I am proud to be a colleague of on a daily basis, and they have risen to the occasion and the challenge of the coronavirus pandemic. It begins with our public health unit. The leadership of our medical officer of health, Dr. Richardson. You'll hear me call her Elizabeth sometimes because that's the way we talk, but I try publicly always to call her Dr. Richardson. But to Dr. Richardson, Dr. Tran, Dr. Harvey, and of course to Michelle and Kevin and Jen, the incredible work of the leadership of public health to lead us through this portion of the pandemic and the way that they will lead us through the rest of this pandemic cannot be underscored enough today. They have been working on this since last January. While much of what we talk about in terms of this pandemic was when we activated the Emergency Operations Center in March, for public health, they knew very early on in 2020 that there was an issue. The size and scope of the issue, no one was clear in January of 2020, but Elizabeth had already put in motion her emergency response for this emerging virus that was starting to go around globally. And as you know, the first case that we saw in this country happened in January of 2020. Their work throughout this, I'll touch on through the presentation. You've heard much about it. Has been absolutely outstanding. To have such a skillful public health unit in a time of a public health crisis is critical. But for me personally, the ability to constantly communicate with this team. Elizabeth and I talk morning, noon, and into the evenings. I probably bug her at times. She wished she had a few extra minutes to do other things. But her willingness to talk through the issues, whether it's from an EOC perspective, whether it's from a community perspective, to educate me on what's happening from the science of this pandemic has been appreciated so much. The more that I can be aware of where things are headed, the better off we all are in decision making. But to the rest of the team as well, they've taken my calls and they've responded to my sometimes my panicky moments, and they've always calmed me down and kept me focused on what we can do to support our community through it. In housing, Edward John is a newer director to this organization, and he has done an outstanding job of managing affordable housing demands alongside an incredible emergency situation with those who are homeless in our community. And it is not an easy job at the best of time to manage a sector that deals with homelessness and housing. And in a pandemic, it has been incredibly difficult. And his ability to look at the crises and manage the crises while also, as you'll hear through this presentation, work on additional items around housing is so much appreciated. Grace Mader has been a leader in childcare for years and knows that well. And childcare became a huge issue in 2020 as things were closed down, as things were reopened, as we had to provide emergency childcare, and she did that. And then, of course, we threw to her, we had a challenge around encampments in the summer months and into the fall and continued to deal with that issue. And again, Grace stepped up and said, I'll take that on in additional capacity and help out our folks in the homelessness and housing area. Ontario Works had to pivot so quickly to a virtual-based service, almost primarily, and Bonnie and her team found a way to do that so that no one fell through the cracks. Imagine in the midst of this emergency, people relying on their social assistance investment on a month-by-month basis and worried about how that's going to happen. Bonnie and her team made sure that everyone was able to get the income they needed on a regular basis. Recreation, I'm surprised Chris Hersteck is standing. Not only has recreation gone through the ups and downs of openings and closures and reimagining how we deliver services, but Chris has also had to deal with all of those user groups that need information and are wondering what's going on and quite frankly are scared for their future and their existence. And Chris and his team has done just a wonderful job of keeping people informed, commiserating where that's all we can do, but also helping people to be successful when we can. Our fire chief, for me personally, has been a great sounding board around emergency management. He knows his business inside out, and along the way, he has been a great sounding board for me from an emergency management perspective. The other piece is we've done a tremendous job of making sure that our firefighters remain safe in their stations. We've not had a lot of COVID-19 positive cases within our fire department, and that's a credit to his continued approach to the infection prevention and control measures. Our paramedic chief, Chief Sanderson, to have this individual in this position through this pandemic has been fantastic. And I'll share a number of things that the paramedics did at the early parts of the pandemic and have done through the pandemic that show just what great leadership Mike and his team has shown. And then in long-term care, we'll talk a little bit about long-term care today. long-term care has been one of those areas that has been such a need for the right kinds of support and the right kinds of leadership. And Holly O'Doherty is our senior administrator, and Karen Allcroft is the administrator at Wentworth Lodge. Both of them have done such a tremendous job of inspiring their 600 employees collectively to do everything we can to not only keep our residents safe, but ensure that we also make sure that the home is still a home for our residents and a place where they can thrive. And today for this presentation, I do want to thank very much Jen Hohall, who is our Senior Project Manager of Business and Support Services, and our Finance and Administrative Manager, Dave Trevisani. They have had to do more work this year on this budget presentation with less input from me because, quite frankly, my day-to-day work is such that I've had very little time to be as involved in this budget presentation as I normally would. And I really want to thank them for keeping it going. And then finally to Lynn Martinello, who kept this whole department moving through 2020. She often would not hear from me for days during my work with the EOC, particularly in those early stages. But administratively, we never missed a beat. And with the amount of resources that we invest in community organizations, it's critically important that we have an administrative leader like Lynn who can make sure that nothing falls between the cracks, because if we don't pay some of our partners, they won't deliver the critical services this community needs. So I spent a little bit longer this year talking about the people because 2020 simply would not have been the year it was without the people that I rely on each and every day. From an overall picture in our department, our FTE count is down in 2021 by just over 31 FTEs. The major driver of that was a change that happened through late 2019 and into 2020, a policy shift from the provincial government in Ontario Works that sees the municipality not providing employment services to the level that we have. We're pivoting to be more life supports and do our lots of other work in Ontario Works, but as a result, it meant a reduction in funding and a reduction in positions in Ontario Works, and that's the major driver behind that reduction. Most of the majority of our employees in healthy and safe communities are either cost shared or 100% covered by senior level of government funding, leaving about 42% that are 100% on the levy. And I show this each year to recognize the investment that does happen by senior levels of government to keep us operational within our department. This is the chart that you would have seen in the budget book. And you can see by division, it works out to a bottom line increase of just under $9.3 million with a net levy impact of 3.7%. But there have been a couple of things that have happened along the way, driven by yourselves, and also some late information we received before this budget presentation that changes that bottom line number. And I'd like to talk about that at this point. If we look at some of those amendments, two of them were, one of them was council approved and one council referred, and that had to do with a reduction in the amount of investment that would come through operations for the Roxborough Community Improvement Plan area. Just to remind the public, this has no impact on the overall project. It's simply recognizing the timing of that project and the ability for us not to have to invest the full 2-point-something million. So a reduction of just over $1 million. There was a referral of operation expenses for a new women's shelter and the supports that are required to operationalize that of $950,000. And then we received some news that helped mitigate one of those line items. If we go back to this slide, you'll see in Children's Services an 11% increase, a $1.2 million increase, and that had to do with a change in the cost-sharing agreement around the administration of childcare and early development services. So that was going to be a big hit this year. Well, we actually received some one-time money to mitigate that hit. So that brings the Children's Services division increase to around the 2% mark, and it allows us to lower the overall impact to the levy to 3.3%. So in this chart, in terms of the drivers, I've done two things. One is provided you in the middle column what those drivers to the budget look like in the budget book that you received. And then the far right column is what it looks like in terms of these latest adjustments to our budget, so that you can see the amount that we're working with now. And it is, as I've previously described, increased resources that help us in Children's Services, and then the changes in Roxborough and the potential increase that will happen through homelessness and housing for the women's shelter. But the real key driver for our department each and every year for the 4,200 plus people that work in our department are the employee related expenses. And those are the salaries and benefits that drive the work that we do in our department. And of the $8.2 million increase, the majority of that is for employee related expenses. You will have noticed on the opening slide in terms of the department by the numbers that we're projecting a $30 million pressure in terms of COVID-19 expenses in 2021. The good news is, as you also know, those will be covered off by COVID-19 reserves. So in terms of a net levy impact, there is none, but I thought it was important to share where those major investments are. And across, it's really three divisions that drive about 27 million of the nearly 30 million. The largest of that, of course, is public health services, and that is largely driven by the increasing staffing that's required in public health services during this pandemic. Simply could not redeploy enough people, work within the public health unit in enough of a way, and so those increased resources will push public health through 2021 in their response to the pandemic. And the other piece, big piece, is in recreation, not an increased cost, but a loss of revenue. And this is really a projection based on unfortunately what we don't know. So we expect that we will be down significantly in revenue, but that's all going to be based on when we can open up amenities, when user groups can get back to participating in the way that they used to. But we expect a very lean year in terms of fees coming into recreation based on the public health guidelines and the provincial orders around what can open and what must remain closed. The final large driver is in housing services, and that has to do with our response to homelessness. This is the emergency shelter spaces that we've opened up. This is the extra funding we're providing for cleaning and PPE and all the rest. And this is also the expansion of our homelessness programs, particularly in the hotel spaces that we now have. When we think about a multi-year budget, it's hard for me to look out because I really don't know what some of these out years are going to look like. But we do see some challenges in 2022 based on the fact that although we're receiving one-time money that's offsetting some of the policy changes in public health and children's services around our cost-sharing agreements, they are just one-time funding to mitigate it. The overall direction of having more municipal contribution towards the administration of public health and children's services is still on the books. We expect it to just keep be pushed out. So I don't know exactly the year it's going to hit, but it could be as early as in 2022, and that's driving a bit of a larger increase than you would normally see. The only other thing I would draw your attention to in this multi-year outlook is that if you look at the long-term care line, you'll see that it is consistently well above an inflationary pressure. And you've heard me state over the past number of years, we simply do not receive a large enough increase in funding from the provincial government to allow us to continue to deliver the kinds of quality services we need to in our two long-term care facilities. Now, what we don't know is exactly what long-term care reform will look like as we move through this pandemic and out the other side of it. That may have impacts in a positive or potentially a negative way on our budget, and that will remain to be seen. So as we shift away from the numbers, a 3.3% proposed increase, you can see where some of those increases are across our divisions. Let's talk a little bit about what we do and why I really feel that the investment that is made, both from a net levy perspective as well as from a provincial and federal perspective, in our department really translates in tremendous effort and tremendous results for our community. This is what our community is set out to do. And I think in 2020, these words ring incredibly true. We were here to ensure that Hamilton is a healthy and safe community. And in the midst of the pandemic, that focus did not shift. I show this slide every year because in our department, we think about the social determinants of health. And even though we've been in a crisis, even though we've been dealing with an emergency, we always have on our mind what are the total things that impact people's lives and actually impact their health. And as we emerge from this pandemic and as we think about what recovery looks like, we're going to need to refocus on those items that we do control from a municipal perspective and can have impact on in terms of what impacts ultimately the health and well-being of our community. So let's talk a little bit about 2020 in review. I've put a note on this slide because I think it's an important one, both as the General Manager of Healthy and Safe Communities and also as the Director of our Emergency Operations Center. You will see photos in these next numbers of slides that if they were taken today, would have us being visited by Ken Leendertz and his team and be given fines and charges. But I need you to know that all the pictures you see at the time they were taken were safely done and were following all of the guidelines that were in effect. 2020 begins and ends with the emergency. And this slide shows our Emergency Operations Center in operation. And again, this is definitely not the way that we would want people to gather today. But in the early days, and this is one of the second or third days of the EOC in operation, in the early days, we were fully mobilized in our Emergency Operations Center physically. We realized in the first couple of weeks that this was a little bit of a risky move. And so we've been virtual for almost all of the pandemic. But in those first couple of weeks, we did gather together and we were physically present. I want to talk about the EOC in two ways. First of all, I do want to say a word of thanks to the entire team that is part of the Emergency Operations Center, over 40 people that are formally part of our EOC structure, but also to the 8,000 employees at the City of Hamilton who have done an incredible job of understanding the direction and the advice that is provided by the Emergency Operations Center, and have helped us understand how to keep critical services going in our community. And we all know about the essential services, those things that we absolutely can't have fall apart. But through this pandemic, we have done everything in our power to make sure that our services are there for the people of this community. And that is a result of 8,000 people looking and understanding what the EOC is recommending, and then figuring out a way to make that happen safely within their work units. So thank you to all of those folks. But I also want to talk about the EOC in the context of our department, because emergency management falls under the Healthy and Safe Communities Department. It actually resides in our fire department. We have two people that wake up every day in this organization thinking about nothing else but our emergency management system and processes and approach. Connie Verhage and Kirsten Marples are two incredible leaders in our organization. And in normal years, they do a number of things. They look at our risk profiles. They make sure that we're following provincial guidelines. They work with divisions and departments around specific emergency needs that they may be thinking about. They help us produce materials for Emergency Preparedness Week for the media and for the public. And then they do another really important function. They train and they support the members of the structure that is our Emergency Operations Center. And most years that training is about exercises and tabletop discussions and some online training that we're required to do to be ready. But when it really comes to fruition, how well they've done that job is when March 12th hit. And we activated our Emergency Operations Center fully to its capacity. We brought in people into their roles. And what I witnessed from the very first moments of the operation of our Emergency Operations Center is that people were well trained. Their training kicked in and they knew what they were going to do. They knew what they had to do, and they executed flawlessly in terms of their roles within the EOC. And remember, none of us get hired with a series of questions about a role within the EOC. There were no questions about an EOC director position when I was hired as the general manager of Healthy and Safe Communities. Or for Nenzi Coca, who works in HR, there were no questions about what she would do as our logistics chief. And imagine in a pandemic, the importance of the logistics chief in those early days when PPE was scarce and we were trying to sort through who were the real suppliers that could actually give us product and supply us with product, and who were the poor actors in that space that were only taking us for a ride. She did an amazing job, not only procuring the right kinds of PPE that we needed, but also setting up a central storage area that is safe and secure. And working with Dan McKinnon and the facilities group, we actually audited our pandemic supplies area to see if we were really meeting all of those best practices about how you would handle inventory, keep it safe, and also keep it secure. Or think about Ken Leendertz, who is our planning chief. Ken has a pretty heavy job already in municipal law enforcement, and certainly through the pandemic, there's more than enough work to keep him busy. But he's also been ensuring that we document properly our decisions and our processes, and has been pushing us to think about some of those next aspects of this emergency as we go through. Or Grace Mader, our operations chief, who works with leaders across the organization. In our department, it could be things like the fire department and recreation, the paramedics. It's groups like the police and some of our external partners who are all part of operations. And throughout this pandemic, it's all been about operations. In the early stages, the emerging need to shut the community down and provide some alternatives for those who needed it when services were being reduced. And through it, it's been how do we adjust our operations and make it work. So when you think about all of these new roles that people are doing, I want to come back and say that your investment in a well-functioning emergency management system set us up incredibly well to deal with this pandemic. And then there were the things that people were doing early on, like our paramedics. And I have to tell you, our paramedics chief in January put in a larger than normal order of PPE just because he saw some things happening globally that caused them to worry just a little bit. Our over purchasing in January driven by the understanding and skill of our paramedic chief, meant that for that first period of this pandemic, we were in better shape than we would have been normally. He did things like set up a special team within paramedics in those early stages, and you can see them on the left here, that had added layers of protection. In these early stages of not having enough PPE, of not fully understanding this virus, when we knew that we were transporting individuals that were either a high probability of COVID-19 positivity or we already knew they were COVID-19 positive, this team was there to support our paramedics. They had an extra layer of protection, which allowed us to be safe. This team doesn't operate as much anymore. We've learned more about the virus, and we've also, outfitted all of our paramedics with the proper PPE to keep them safe. But these are the kinds of things that were happening early on in this pandemic that show you the leadership in this department. And then our public health unit. So I'm showing a couple of things here, which are an illustration of the other things outside of the direct delivery of public health that they've been involved with in showing leadership, because I want to tell that story too. We know that in terms of the hotline work, in terms of contact tracing, of case management, of infection prevention and control measures, of outbreak management, that this is the direct service and the direct involvement of our public health staff in this pandemic. But I have to tell you that each of those folks that I mentioned off the top in our leadership structure in public health are working in the community with broader health sector partners and community partners to drive the other important elements of this pandemic, and they have been since day one. These tables include more than just city staff. They include our community partners, and that's what's needed in order for us to have the right response, because our public health unit cannot do everything alone. In testing, it's not been just our public health staff that have been involved in testing, but they have been leading that from day one. And they've been doing interesting and creative things, working with our folks in recreation and in facilities to transform the Dave Andrzejczyk Arena into our drive-through testing piece. And rather than have flimsy tents and that kind of a drive-through outdoors where inclement weather is always a problem, we moved it indoors and had a great setup. But the testing is being done by some of our partners, but Dr. Richardson and her team are always there showing the leadership and helping to make sure that it is the right approach for our community. Over 240,000 tests have been done to yesterday's count within our community. And this will continue as we move into the exciting phase of our vaccine rollout. Our public health staff will not be the only ones delivering our vaccine in our community. And on the left side of the slide, you can see the first person in our community getting the vaccine. That was a great moment in December. But our public health folks are at the center of understanding how best to move forward with the plan for our vaccine in this community. They are tapped in, and Elizabeth's calendar, I think every second meeting is something to do with vaccine right now. And that's the way it should be, because in 2021, that will be a key focus area. And their leadership in how we do mobile vaccine programs, how we may in the future set up mass vaccination sites, how we were working with Hamilton Health Sciences in the early stages of the fixed vaccination site. All of that work is where our public health is showing leadership, not always just our staff doing it, but the leadership of public health for this community. The parallel story to the pandemic writ large is going to be long-term care. When we emerge from this, there will be many, there already are commissions and things in place. There will be more, and there will be much discussion about what needed to happen differently and should have happened differently and what we need to do in the future in long-term care. And we'll be part of those conversations because as a municipality, we have 430 long-term care beds in our two long-term care facilities. And in 2020, I couldn't have been more proud of Holly and Karen and all of the team and the way that they've handled themselves. They knew from day one that the protection of our residents was going to be a difficult task, but one that they could not let up on for 1 minute in any given day. And they have been doing all of the great work to ensure that we keep people as safe as possible. This virus is tough, and I call it evil. And as you know, at Macassa, this virus took a little bit of a hold in early January, and we are all deeply saddened to watch the impact of this virus on our residents. And the 8 deaths that have occurred at Macassa Lodge are something that weigh heavily on all of us. But watching the team jump into action in terms of the way they handled this outbreak is something that's inspiring. As I hear stories of other long-term care facilities where frontline staff don't know where their leadership is, I had conversations and have conversations on an almost daily basis with Holly, and she's always at the long-term care facility. 9 o'clock at night, she's like, Paul, I just need to finish off a couple things here at Macassa, then I'm going home and I'll do that email when I get home. She ensured that her broader leadership team was available, and in the early part of the pandemic were there 24/7. So even that person working in the front lines at 3 in the morning knew that a management level person was there and visible and accessible to our staff. We have kept our staffing levels at as high a level as we possibly can, sparing no expense and investment in order to protect our residents. So even in these toughest moments of outbreak, we've done what we need to do, and I think we've done what all long-term care facilities can do, and I'm so proud of the work that's going on there. But along the way, we've also realized that as much as we have to be worried about the protection of residents, this is still their home. We need them to thrive. And so it has been the extra iPads and the extra time and energy we're putting into virtual visits when people can't come in and see their loved ones. It's the celebrations of birthdays, the celebrations of 70th anniversaries that have kept this place human, while we also have all sorts of PPE on, all sorts of protocols in place, and of course, all sorts of restrictions on who can come in and out of our center. When we look at COVID-19 from the numbers perspective, huge numbers of work happening, for instance, at the COVID-19 hotline. And this is just at the time that we produced this report. So that number is much higher than 30,950 now. All of the calls that public health is fielding with people. And these are not quick calls about, hey, what's the address of this? Maybe some of them are, but most of them are people that are very concerned. They have deep questions. They're worried. They're anxious about the issues of COVID-19. And our folks are taking the time to reassure them and connect them with the right supports. Our paramedics have over 9,000 times been sent to a call where the dispatch has alerted us that this is a suspected COVID-19 positive individual based on the screening. Not all times does it turn out that way, but you think about that on a daily basis, all of those calls that our paramedics are sent to where they have to be hyper aware of their need for proper PPE. They provide a very close contact care, as you know, to individuals. And over 9,000 times they were doing that within the back of their mind, wondering about COVID-19 and this virus. In our department, we have, in terms of long-term formal redeployments, have 176 people doing other jobs to support the pandemic response. I can tell you that number is much higher with people that jump in and out for short periods of time that we're just, not really able to track. Public health and the 154 outbreaks that you managed. And I've got this old saying now is if you've seen one outbreak, you've seen one outbreak. Every outbreak is different. The physical layout of the facility, the numbers of staff and the quality of that staff, all sorts of different things go into outbreak management. These are not things that are half-hour phone calls with a checklist and that's the end of it. These are sometimes deep and long conversations that need to occur, and sometimes taking it to that next level of issuing orders and compliance requests so that we can get these outbreaks under control. From a paramedic perspective, we're also working with the healthcare community to keep people in their homes as much as possible. The less time we can spend going on site and transporting people to hospital, the less risk we have in terms of some of that transition happening. And our paramedics have been involved not only in working through the transportation of patients and trying to keep patients in their own home, we've also been involved in the testing that's going on and will be involved in the vaccination that will roll out. And it's not a little piece of task. It is a large role now of our paramedic service in this community to support the overall efforts around the pandemic. And the increased investments in community paramedicine are really paying off. And then there's these little pieces, again, I call this the creativity and the wonder of the folks that I get to work alongside each and every day. When some of the wellness clinics had to close that we've been supporting through paramedics, particularly at City Housing Hamilton buildings, they took to the phones to check in with those folks. It's so easy to say it's closed. We hope you're okay. Here's some other places you could contact, and we'll see you when it reopens. But no, our folks took to the phones, make sure that they were still supporting people, even though they couldn't do that in person. Our public health unit has worked alongside municipal law enforcement so that we can build a broader team of enforcement from an inspection perspective and an enforcement perspective on certain elements of the bylaws and the orders around this coronavirus. And so in terms of our masking bylaws and our physical distancing bylaws, some good cross-training and the ability to use more resources to deliver that. And I just can't say enough about the help that public health has been in all of the signage and the advice and the verbiage that we need to provide to the community to help them understand how to keep safe. And at every turn, they have dropped everything to review something, to give us help on wording so that we can be clear and precise with our community as we move through this pandemic. We knew in the early days of this pandemic that there was a huge risk to our homeless population and also a huge challenge because our homeless shelters are not designed to comply with infection prevention and control measures. They are not great places to stop the spread of viruses, any of them, and in particular, this coronavirus. And so we leapt into action in terms of how were we going to work through our emergency shelter challenge. One of the things we needed to do was do quick assessments in partnership with our health partners through the Shelter Health Network and with public health to look at what was safe, what were the safe levels of numbers within our existing shelters. It was lower than we would normally be used to. And then we realized how we need to increase capacity. We've done that primarily through hotel rooms. And as you can see, we have at this moment 184 hotel rooms that are available to homeless men, women, couples, all of those things, and families if necessary through this pandemic. But then we also realized that we needed surge capacity. In the old world, we have a cold alert night or we have something going on. We just encourage our shelters to put out a few extra cots, put out a few extra beds, and squeeze a few more people in the facility. With the spread of COVID-19, coronavirus, and the threat of COVID-19, we simply couldn't use that approach. And so again, we worked together and in 5 days went from decision making at the Emergency Operations Center to the first head hitting the pillow in our expansion shelter at First Ontario Centre. And that is, again, a combination of factors between Spectra and working with them, our facilities folks, even our chief building officer, Ed Vanderwint, needed to be in there with his team. And I'm sure we probably skipped a few steps or we're doing things concurrently that we should have been doing consecutively, but he was fantastic in helping us make sure that we were setting up a safe environment in a building that had never been contemplated as a homeless shelter. And through those early stages of the spring and this crisis, this shelter some nights had up at over 50 people, up to 75 people sleeping in it in order to keep people safe and distance in those early stages. And then as the summer wore on, we transitioned this to an additional temporary site and closed this one down at the Cathedral Boys School. But this is the former Cathedral Boys School. So this is the kinds of creative ideas and responses that we've had throughout this pandemic, and it's indicative of what that housing and homelessness group is all about. The other thing we realized is if people were showing symptoms, we needed to find ways to make sure that they were separated within shelters while they've got testing. And we have a rapid testing protocol and have from the early stages. And we also did surveillance testing in the early stages when other communities weren't, in partnership with our health partners to make sure that we could identify COVID-19 before it became a huge outbreak problem in our shelters. The other thing we needed to do was set up an isolation space. And in the early stages of the Bonetto Isolation Center, this was fully staffed by City of Hamilton staff people who put up their hand and said, yes, I'm willing to help come and work and support people who are COVID-19 positive. And you think about the fear and anxiety we all had in the April time and May time in the early part of learning about this virus. And for our staff to put their hand up and say, I'm happy to go and work at a site that is going to be for COVID-19 positive individuals is just heartwarming. And so we've had this. Unfortunately, we're having to restart this potentially because of the numbers that are growing a bit. But the good news is that even though you've seen through the month of January some outbreaks in emergency shelters, the numbers associated with those outbreaks are incredibly small. Again, a credit to our partners who are doing everything else, everything that they can to stop this, and a credit to our Housing Services Department who have been funding PPE supplies, cleaning supplies, and have been working with them through public health and through housing services to make sure that they're able to respond if we do have some of these cases of COVID-19 within the shelter system. The other piece that the municipality was asked to do is distribute money to other community organizations to help with the COVID-19 and the coronavirus response. We distributed over $640,000 to 32 organizations that helped around 33,000 individuals. And the great thing about this was not only did some of that resource get invested in community organizations that we've been working with for years to expand some of their reach and scope, it actually supported a number of organizations that Some of them I had no idea even existed in this community and had never come to the city for support. They were doing their work and it was great. But what we were able to do was leverage neighborhood associations, faith group organizations, groups that work with specific populations within our community who already have relationships with vulnerable individuals. And by investing in them, we were able to have a broader response. And then our staff team came together because we were hearing feedback from our hotline in public health that a number of vulnerable people in our community needed help. If they were having to isolate because they had tested positive for COVID-19, they didn't have access to food. They needed somebody to go and get medication. So in order to make sure that they could stay isolated, part of the job of this small group of city staff was to deliver food, make sure that things were picked up. Other times we were arranging for transportation to appointments so it could be done safely. We were finding the supports that were required for people. As you can see, the majority of it, or about half of it, was about food support, but that's wonderful. And some of these folks that worked on this were employees for whom their normal job wasn't really having much happen because of the lockdown. And so to redeploy people, for instance, from recreation who also had city vehicles, who said, great, we can deliver all over the city, take food to people that need it, make sure that we're connecting with folks. And I can tell you those employees have been feeling so valued in terms of being asked to do something that's helpful for the pandemic response and utilizing their skills and their abilities and the resources that they have at their disposal in order to be part of the solution. In Ontario Works, think about this, a business, as many of you know, that has been driven by coming in and seeing people. Yes, we do some things on your line, and yes, the phone is always there, but there's always this moment in Ontario Works where it says, we need you to come in and see somebody. And then all of a sudden, you couldn't come in and see anybody anymore. And Bonnie and her team, as I mentioned, did a great job of transitioning to a virtual world, but also supported those. We have a small number of people who still need a physical check each month for their social assistance, and they've been able to do that in a safe way and support those folks as well. It has led to conversations about how our clients can access more supports online, and that's been great, and the province has been very supportive in this effort. And the other piece that I really appreciate about Bonnie and her team is they have been using some of their flexibility and discretion and funding that the province provided to support people with extra PPE, cleaning supplies. We've had people on Ontario Works phone and say, look, a member of my family is COVID-19 positive. I don't have PPE, I don't have cleaning supplies that will allow the rest of the family to stay safe. And we've been able to invest in those things along the line. We did keep some services moving and going, even though that we're focused so much on our pandemic response. There are other items that are vital to people's health. And I am really pleased that we've been able to keep some of those programs going. One of the things that you as council have been so supportive of is our dental services, our oral health work. And I can say to you that I was, so excited that we were able to find ways to keep that service moving. Yes, it's in different ways. Yes, it's not the same volumes that we may be able to accommodate in the past, but we have been able to be there for people whose dental services need to be supported by our public health group. And whether it's at the dental bus or whether it's at our fixed site location, we're there to support them. It's other pieces like helping families to get their children caught up on their other vaccinations, not for coronavirus, but the other vaccinations that need to happen. All of those bits of work were happening while we were also responding to this crisis. And so all of our divisions across the department found all sorts of ways to continue to provide support. Mental health needs and addictions needs don't take a break just because we're in an emergency and just because we're in a provincial lockdown. And so we were able to transition to a virtual way. And the one that I want to draw your attention to, because I know council was really excited when we started this in person, was our walk-in mental health services for children and youth. This is an opportunity for families to not have to book an appointment for days or weeks out, but actually have an opportunity to walk in with some of the crises and some of the challenges that people face that's really emergent. Well, what do you do when you close down? What we did is open that up as a virtual piece as well. And so we've been able to support people through appointments, but also be able to support people in just walking up virtually and getting some of that service. And the other one that you may wonder, burn permits, really? Well, burn permits are really important, particularly in some of our rural areas of Hamilton. And it has been an in-person paper-based process for years. And so we quickly transitioned. It took us 2 or 3 weeks, get it online, allowed people to apply for those permits, allowed us to receive the revenue from them. One of the things we were thinking about is we just kind of permit it without worrying about the transaction, but we found a way to make sure we could gather the fee, give the permit, and support that kind of work. And so it's been really great to watch our department pivot and do their service in different ways. Home management, which is a one-on-one place-based support service for vulnerable people, went totally virtual. We've eliminated our wait list. And yes, we do need to get back to, and there will always be a strong place for the in-person services. But one of the continuous improvement pieces I think that will come out of this is our ability to build on the virtual offerings alongside some of our in-person operations once we're able to get safely back to that kind of a delivery model. Our senior center without walls through recreation has increased from 4 classes per week to 20 classes per week. It's over the phone support for seniors. Sometimes it's trivia games and things like that, even a bit of physical activity done through a connection over the phone for isolated seniors who obviously do not have access to their normal senior center programming that is so much the lifeline for many of those individuals. Where would we be without our online ticketing program in recreation? Well, I can tell you, we wouldn't have been able to open our outdoor ice rinks. The chaos of people simply arriving at our ice rinks without a reservation system would have been too much, I think, for us to handle. So the ability for this to be used in a variety of settings, but I think a highlight of that is the recent opening of our outdoor ice rinks. And you know, in the summer, the spring and summer, when we were able to safely, we encouraged outdoor programming in different ways. Our early on centers have been closed through much of this pandemic because of the obvious risks of being indoors parents with young children. But we could do some outdoor programming in the summer, and we did. And then I had to throw in this picture on the right side. In the spring and the summer, when there was this wonderful window that allowed people to come and visit their loved ones in long-term care. Yes, it had to be 6 feet apart. Yes, you couldn't contact or touch anybody. But it was this great moment where people could physically be together, and we did everything in our power to accommodate as many visits as possible. Our recreation folks are hardwired to get people moving and active, and they love their job, as you can see in this picture on the right side. And, you know, they were challenged because people couldn't come to our facilities. We weren't running in-person programming indoors. So they did things outdoors. They did pop-up visits to all sorts of parks and areas in our community. And then they developed kits that people could take home that provided some interesting ideas and opportunities for families and their children to get active and keep active. And we did that in the summer, and we've been doing it with the free activity kits in the winter as well. And so those are some examples of the things that have been going on. And normally in this section, I would be going through KPIs of all of our programs. Impossible to do that in 2020 because much of our work was so dramatically changed that showing the change from last year to this year just would be really an exercise in providing information without a lot of context and without a lot of ability for us to say whether that's good or bad. It just is what it is. So the is what it is of all of this great work that's been going on does need to be balanced with there are a few areas for which work continued in a very similar way. And I want to show a little bit of how we performed in some of those areas from last year, from 2019 to 2020. I'll start with paramedics. And there's an interesting story in paramedics. Lots of people heard that early on in the pandemic, there were far fewer calls for service, and that was absolutely true. And if you look at the green shaded area, you'll see that our average calls per day in paramedics were about 194. And during those first couple of months of the pandemic, it dropped to 176 per day, a significant reduction, but it didn't last. By May the 22nd, our call volume went up. And in fact, from May the 22nd through the balance of 2020, our daily calls for service increased by almost 30 calls a day. So there has been this interesting piece in paramedics through 2020. And here it is depicted in a slightly different way. And the only thing that has been consistently below is the transports to hospital. And some of that is our work to keep people in homes. And some of that is also people's probably lack of desire to go to hospital in the midst of the pandemic. From a fire department perspective, one of our key performance indicators is how are we doing in our response time to our target. And I can tell you across both types of calls and across our career, composite, and volunteer firefighting stations and structure, we beat our performance targets in each and every one of those in 2020. That didn't have anything to do with the pandemic. It actually has to do with some work that fire's been doing through its 10-year plan to better allocate apparatus across the city and move to a better electronic system through dispatch that allows us to do more closest unit available dispatching, which has helped driving our time. And we expect that we'll see some additional improvements as well as we go forward. And so from a fire perspective compared to 2019, some of the typical things you would imagine have gone up. And one of the things for any councillor who has an escarpment trail or a waterfall in their area, you know this. The word is we had a few more people than normal coming to those areas, and it's a concern on a number of fronts from a parking safety perspective and a pedestrian safety perspective. It did also lead to a driving up of the number of rope rescues that we needed to attend to in 2020. The piece that is down is vehicle accidents. I'd love to say that's a trend, but it simply is a reality of less people on the road. Housing and the need for affordable housing didn't take a break during the pandemic. In fact, it's become more heightened. And in terms of our performance indicators, they got a little bit worse in 2020 in terms of the need for social housing. And these are those 14,000 or so units across the city of Hamilton that are rent geared to income. That's what this wait list is all about. And so there was an increase from 5,100 or so to just under 5,600 in terms of those who have active applications waiting for social housing in our community. And that is an increase, obviously, from 2019. And so we know that we continue to have to drive not only the construction of housing that's affordable at some level, we need to continue to drive programs and investments that for some get to the deep affordability questions, which will allow people to come off that wait list and get into truly affordable housing. One piece of good news from 19 to 20 was the increase in the number of people that are being housed from our wait list. So the wait list is the measure, and how we get people off the wait list is a sense of success. And some of that is to do with things that launched late in 2019, which some things like the Home for the Holidays program that renovated quickly a number of units in City Housing Hamilton, and our continued work with housing providers to have vacant units turned over much quicker to get people into those. The other piece that's driving this is also our ability to work with some people on the wait list to go into a rent supplement program instead, get them into affordable housing faster than they would if they were staying on the wait list for social housing. I do want to comment on a few of the areas that relate to term of council priorities, and I do this each year around EDI, around our climate change work, and around continuous improvement. And when it comes to equity, this is a slide I've put up for a couple of years now, and I like it. When we talk about a lot of our programs, it's not just about giving everybody the same program, because if we talked about that in terms of cycling, it would work well for some to get the same bike, but if we gave everybody just the same bike, it wouldn't work well for others, and in fact, for others, it would be useless. And that's the way we look at our programs, is how do we think about the goal? And if this case it is to get out and roll, then how do we make sure that the tools and the investments that we're making allow people to do that? When we think about childcare, this is about equity. It is about inclusion within the workforce and within education. And in 2020, it became a highlight of just how important this relationship is to our economy. Grace Mader, Brenda Bax, the team that is in our children's services, right away when this pandemic started to break, knew that childcare was going to be shut down. They knew that we're going to have to provide childcare to some people, because for essential workers, this was really critically important. And I want to tell the story of emergency childcare. Every municipality did emergency childcare, so that's not a particularly interesting thing to talk about. We did what every municipality was doing. The how we did it shows the innovation and creativity, I think, of our children's services area. They came and said, look, we have a bit of an idea about how to do it. And I expected they were going to say, here's 2 or 3 sites we're going to open up. I get 50, 60 kids in each of those sites spread across the city, and away we go. And they said, you know what? We'd really rather use our licensed home childcare system. Many, many more locations, which is good because it could be closer to where people live or work. Hey, that's a great check mark. And then they said, and we've been thinking about risk. Licensed home childcare is up to 5 children. Our center-based childcare centers could be up to 50 or 60 people. And think about it, if an outbreak did occur, and we saw this in other communities, all of those families had to head into isolation, had to get tested. And these are essential workers. We need them to keep going. So our approach was both a lowering of risk approach, an increasing of convenience approach, and it is exactly the same approach we're using now that we're back in lockdown and providing emergency childcare. The other piece that we've been doing is ensuring that we're supporting and working with our childcare system so that when we get back to fuller utilization, when we come out of this at some point, whether it's 2021 or 2022, that our childcare system is actually intact and able to respond. If we have childcare centers that cannot last, fold, go out of business, that is going to be a huge challenge as we recover from this pandemic. And so the work that they have done to invest strategically to ensure that our childcare system is strong, working with the province and understanding how we can utilize our funding effectively, means that when we get back to that fuller utilization, we will be able to ensure that it is there for people who need it. Our work on our urban Indigenous strategy has continued through this pandemic, and it's exciting work that's accelerating beyond looking at a plan into some of those specific actions. And some of it is about events, and I was really glad that we did both in person and then had to move to a virtual event for our Murdered and Missing Indigenous Women and Girls program, so that people could continue to learn and understand really the depths that we need to go if we're going to talk about true reconciliation. We're looking at practical applications of how we work with our Indigenous community and projects in this community through archaeological and natural heritage issues, for instance. We're looking at how we can build Indigenous health equity within the services we provide as a city, but use that as ways of influencing other parts of the healthcare system. We have an Indigenous health specialist as part of our public health team that's helping to drive that work along. Youth in construction you heard about yesterday. Dan and I put this slide in each of our presentations each year because it's this collaborative venture around it. Discussion of youth in construction starts with a thanking of Dan. Dan started this project. It was his, he was the person who thought about this project and thought about using connections to the construction industry to help youth, particularly at-risk youth, with an opportunity to look at an education and training program that could help them be successful in the job market. He then came to our department and said, look, how can we structuralize this a little bit better? How can we grow it? And how can we tap into the knowledge and understanding that our department has of the community? And he tag teamed with a wonderful woman named Irene Heffernan in our department, and together they have grown this project. And to see the number of applicants now that are wanting to be part of this project, to understand how many people are graduating and getting employment from this, really does talk about some of those pieces of work we're doing to balance the scales a little bit for populations that need it. Youth unemployment is typically always higher across the board than the average unemployment for the adult population. But when you go into specific youth populations or at-risk youth, as we would call it, the number jumps even higher. And so our ability to level that playing field a little bit and get people into a career track job search option is something that we're pretty excited about. I talked a little bit about housing already, and I want to start with this graph here. Housing is critically important. Not only is it a prime driver of our social determinants of health, we understand just how it impacts all sorts of things, everything from crime to person's health to even the well-being of neighborhoods. If we have the right mix of housing and we have housing options for individuals, we will be a healthier community. But it's often suggested that it's senior levels of government that are investing, and municipalities in general are not coming to the party. And as I've demonstrated already, that's not the case. This does not mean for a minute that more investment shouldn't occur. It should. We do need more. And if we really want to move this forward, we will have to have new investments across the board. But I think it's really important to look at this chart and on a 5-year average recognize that $55 million of municipal tax dollars go into affordable housing and homelessness programs. And as I say, that is a both new build, which is critically important. But I got to tell you, I spend a lot of my time worrying and thinking about and investing in the existing housing stock, because if we lose that, then any gains we get in new build are going to be lost. The reality in 2020 is we continue to do a strong job of moving people into housing and constructing new housing. Over 700 households were housed in the midst of this crisis and pandemic, and everybody worrying about the safety of all sorts of things, which is a tremendous number. In terms of what was approved or what was started underway in 2020 and will come to fruition in 2021, we're talking about at least 400 new units of affordable housing. And some of that, of course, was buoyed by the announcements last year of the Rapid Housing Initiative. And we expect more of these announcements to come. I'm also really pleased to let you know that this month we've started a pilot program with St. Joseph's Healthcare Hamilton and the Canadian Mental Health Association, their local chapter here, working with the city and with City Housing Hamilton to start an intensive supports pilot. This will help about 15 individuals who are high acuity, and we've all learned what that means through looking at homelessness and encampments. High acuity folks to receive the right kinds of supports in a permanent housing setting. The first 3 or 4 are getting very close to moving into those units. As you can well imagine, the relationship that needs to be built with these individuals before they move into housing takes a while, but we are on that track. And the best thing is we are working with our health partners to deliver the right kinds of supports to those who have significant mental health and addictions and also physical health issues. Paramedics are helping with health equity, all of those actions of mobile activities, getting to where people have less access to health care, or maybe the access to health care isn't as strong as it needs to be. And it could be things like those expanded flu immunization clinics that are happening in high-risk seniors buildings, where we're able to take the health care and preventative health care that's required to people, rather than forcing them to find their way to places in the community. In our fire department in 2020, like many areas within the city, so I don't want you just to think that it's just in the fire department. Many areas of the city, the employees of those areas do not reflect fully the community that we serve, and our fire department is no different. The chief is not sitting back and saying, well, we hope this solves itself over time. He's actually taking some steps to address this right now. Using the brain power of City Lab and our human resources area, he's looking at ways that we can accelerate outreach to specific communities that would help us in terms of a diverse population working within our fire department. And if we have something to look to in terms of the success that we can achieve, it's the work we've been doing for a number of years to attract more women into our fire department. Here you're looking at 2 of the heroes of the work that's happening in our fire department, Mary Hindle and Pike Kirpan. Pike, of course, was one of the city's nominees a couple of years ago for a Women of Distinction Award, and both are doing tremendous work of being mentors and also creating specialized programs. In the case of Pike, the Camp Fit program that encourages young women to come out for a weekend and experience some of what is required to be a firefighter, and also do that with the leadership of women firefighters, and talk about how this is a career path that should be one that people consider. So we have some things that we can build on as we look at further diversifying our workforce in the fire department. We're really lucky in Healthy and Safe Communities to be the home to the secretariat that drives the corporate work around climate change. And you'll see on these next slides, we talk about our climate positive work. And this is a phrase that we're using to engage and inspire our staff to think about their work in terms of, is it climate positive or not? We don't need climate neutral. We don't want climate negative. We want climate positive so we can start to make some moves. And whether it's neighborhood level work, which is what you're seeing on this slide, where we're going into neighborhoods and testing out ideas that can be then scaled to the rest of the city, or whether it's our investments in the Bay Area Climate Change Council, which is really going to look at the broader set of partners that are going to be needed if we are to tackle this as a whole community. All of that work is being driven across our organization and led by a team. You've seen Trevor Imhoff and his presentations to you before, a passionate group of folks that know how to focus our priorities on the things that will matter. And, you know, we submitted the community's work, not just the city of Hamilton, but our community's work around greenhouse gas emissions to the Carbon Disclosure Project. And our score was a B. And we want to be an A, and we want to get there. But I could tell you that many municipalities across North America are in the C and D range. And so we have much work to be done. This slide is not to say in any way that we need to stop. But as we take stock every once in a while of where we are, we have some things that we can build on, and we will continue to do the work that's necessary to address this important issue. And within our department, climate positive work can be about going electronic, and it has many benefits. We have a lot of paper, and social services for years has been driven by paper. We talk about Ontario Works. We had huge rooms full of files. Well, they are all electronic now. We use 2020 to go all electronic. It's better from a client perspective, less chance we're going to lose things along the way. Better from our employees' perspective, they're able to access things electronically and send them electronically. And we don't have people driving in with pieces of paper. We don't have to deliver through vehicles pieces of paper to various offices. We are able to now do things electronically. It's better for our service delivery in both Children's Services and Ontario Works, and it's better for the environment. Our urban farm continues to be a beacon of what can happen in urban areas in terms of farming, and we generate revenue from the produce that's produced there. We provide it to at-risk communities, including the McQuested neighborhood, and we're encouraging more and more people to get on board with what urban farming and small community gardening can be all about. In our fire department, I've talked a little bit about driving better response times. Well, that's also good for the environment. The less time we're spending driving, the less distance we drive our large vehicles in fire, the better off we are. And I've included one of our fire our pumper, in this case, one of our fire apparatus here around emission standards. And I'm sure a lot of people are sitting there going, Paul, do you really, really believe the best thing to put about climate positive work is a huge fire truck that's driven by an internal combustion engine still to this day? And I get it. There will be a day, I assume, sometime in the future where our fire apparatus is driven by either a hybrid model or maybe electric or hydrogen or something. But today that technology doesn't exist. But that doesn't mean we can't be better. The units that we are replacing now, and recognize that a pump or a tank or a ladder is replaced once every 20 years. The units that we're replacing them with now meet the highest emission standards on the market. And that is good news. And just think about it, if you actually kept a car 20 years. So if you had a car today that you bought in 2000, do you think it would be anywhere near as efficient as the new cars that you would buy today? The answer, of course, is no. And so just by the virtue of changing our fleet to the most efficient that we can find today, we are having somewhat of a positive impact on the environment. And I expect as the technology gets better, we will do that in even better ways. We're piloting 2 hybrid ambulances, and we expect that if they perform the same as our gas-powered ambulances, that we will then accelerate the replacement of our vehicles to a hybrid fleet as well. In recreation, we're looking at ways of using the smallest amount of chlorine possible to keep our pools safe and keep them comfortable for our swimmers, of course, but also make sure that that we're not wasting chemicals just for the sake of using a chemical. And the other piece is that we're looking at standards across our pools in terms of temperature. And don't worry, we're not going to set them to the Polar Bear Club level where everybody's freezing when they get in. The comfort of our users is a high importance. But we do need to be consistent. And if we are consistent, that will save us energy and also save us money at the end of the day. All of our construction in affordable housing is meant to be as high performing as it can be. And 2 great examples. One is a renovation that you know about at Ken Sobel Tower, 500 McNabb. It's going to be renovated to Passive House standards, which is an incredibly high performance standard. And then our new builds are doing that as well. And one of those new build examples is the Indewell project, their North End Landing initiative. Ontario Works has consolidated sites that happened through 2020, and this is a bit of the continuous improvement that's going on in our organization. And this is where it touches a number of things. It's good on the money side, saved us $500,000 to consolidate our sites, and that actually allowed us to not have to put a pressure on the levy this year in terms of some provincial funding changes that occurred in 2020. It also is it's good from an environment perspective. To have less buildings is good from an energy perspective, and we're able to have less people traveling between sites. And the other piece is it's going to allow us to be more creative and innovative with our service delivery, going into communities, to existing community centers and delivering our service. We do that a little bit now. McQueston or Riverdale come to mind. We also have some time that we spend in Waterdown, but we want to do that in more of a capacity and have less people in our big locations. And then in fire, they're always recruiting, always training. It's a never-ending cycle in it, and that's how we keep our numbers up, both on our volunteer side and our career side in fire. But we've undertook an exercise in 2020 to look at how to make that most effective and efficient it could be. And in doing that work, we saved about 1/3 of the weeks of time that is spent on a recruitment. And that means more leadership time devoted to other activities, and more of our frontline recruiters and trainers spending more times on activities that probably were sitting on the side of the desk and not able to be gotten to because of the time they spend on these types of things. This will allow us to continue to have a strong recruitment and training process in fire without adding new resources. And another piece of continuous improvement in fire is something that we reported through the 10-year plan, and that was looking at how we could redistribute the map in terms of our composite model of firefighting. And this is not meant in any way to change our overall approach to having a strong volunteer firefighting contingent and a career firefighting contingent. It is really understanding the change in our community and the way that our community is being built and the needs of those residents and businesses in terms of our response. And so by adding more into the green from the before and after, it's really the green that has changed. In a couple of areas, it allows us to have a stronger response by still using the resources in a very effective and efficient way. Our paramedics are going to be able to, in mass events now, have bike paramedics going out and doing advanced work in medical care. This is something that we've lacked. So if you think about it, and I get it, you know, a big event now is me sitting alone in my house. But when we get back to Supercrawl, when we get back to the Ancaster Fair, when we get back to having Ribfest and Waterdown, all of those things, you know, present a challenge for us getting to people who may be injured or are having a medical issue. And by having a bike unit paid for, not by the taxpayers of Hamilton, but actually by a grant from a fantastic foundation, the Firehouse Subs Public Safety Foundation of Canada, we're able to improve our service to the community when we get back to having those large-scale events. Our paramedics are also doing continued work in reducing offload delays, thinking about every creative way that they can support people to stay in their home, not have to go to hospital, and finding ways to divert patients. And we're starting to see the change in that legislation bear some fruit, where we're able to do diversion from hospital to other more appropriate treatment locations. Our department is working with economic development to make sure we support business in a strong way. When you open a restaurant, public health is involved. When you open businesses, fire's involved, those things in our department. It's not just about planning and economic development. And so working with them for the Open for Business initiatives, we've found ways to support businesses with stronger tools about what they need to do, and also integrate our work so that we can be a stronger support faster when businesses are getting ready to open. And then our food inspection folks did a bit of work with their data analysts and with IT to look at how we were spending our time and where we should be spending our time in terms of food and water inspections. There are places where there are higher risk establishments, more clustered. So we looked at the districts, and this is going to allow us to spend less time traveling between appointments. This is going to mean that we can do more of those inspections with the same staff that we have. And the staff love it because they're spending more time doing the job that they actually want to do, rather than spending time traveling all over the community. And again, these are examples of the way that we're thinking and continuing to improve. And by the way, we did all this in the midst of a pandemic. In long-term care, it really is about what we can do with virtual care and electronic tools to help keep our residents safe during a pandemic and an outbreak, and of course, all the other times as well. And so having coordinated applications that go into one electronic clinical chart are really important. Skin and wound care is incredibly important, and it's a high priority area for the Ministry of Long-Term Care in terms of their inspections. And now we're going to have that information available in our additional electronic tools that we use. We're looking at ways that we can do virtual consults with physicians and other medical professionals to stop having to transport people out of our long-term care facility or bring people in. We can do it faster, and we can do it with technology. And so those are some of the things that happened in 2020, both from a continuous improvement, both from a pandemic response. And now I want to spend just a few minutes before I wrap up with our business case. Just want to spend a few minutes looking at 2021. I wish I had a stronger crystal ball on both sides of this chart, but I don't. You can be assured that our department will continue to do what it has been doing since the start of this pandemic in terms of responding to coronavirus and the incidences of COVID-19 in our community. We will do everything we need to do to ensure that our community is safe, to transition to this immunization strategy that we're all looking for, and ensure that along the way, our services are delivered in a way that can support people in different ways. When exactly that work will end or start to slow down, we don't know yet, but we will continue to drive that, and that's a big piece of what 2021 will look like for our department as well. And then there are these other things that quite frankly keep me up a bit at night. And I need to share them with you today because they could have an impact on the decisions and the discussions that you need to have perhaps in 2021 and certainly as we head into 2022. The first one is about rent freeze, and it's both the elimination, but it's also the rent freeze itself. The rent freeze is good for people. It means that they can maintain a knowledge of what their rent is going to be. But for our housing providers, and particularly our social housing providers, it's meant a gap in income. In terms of City Housing Hamilton, it's over $1 million. Across all our social housing providers, it's I think the report that we brought forward was over $2 million. So whether this becomes a pressure that comes our way as the service manager for social housing or not remains to be seen, or whether it can be absorbed by those organizations. But the other side is all of these supports, rent freezes, special income supports that are out there, they're all going to end at some point, or at least that's what we're told. And we don't know what the impact of that is going to be on issues like homelessness and the need for affordable housing and some other issues that I'll talk about. Our shelter system is going to have to transition back to more of what it looked like before. We're going to have to invest to make it safe, and we're also going to have to do that work of transition. We've been able to manage a larger shelter system right now because of the investments provincially and federally. When that resource stops, we don't have the capacity locally with the funding we already receive to continue to support all of the spaces that we've created through this pandemic. So we're going to have to work at that transition and continue to advocate for financial support through that transition. Long-term care will be reformed. Exactly how that rolls out, we don't know, and how that will impact the finances for our 2 long-term care facilities is anyone's guess. Our not-for-profit sector is going through a really hard time. It's not equally distributed. Brian McMullen sent me a great report that talked about the impact on the charitable sector. Some charities are actually doing better in 2020 than they ever have before. Others, especially those that rely on in-person events for fundraising and things like that, have been devastated. They're also experiencing higher volumes of need. How that will impact things like our community enrichment fund applications or the requests that are coming towards our department for financial support will remain to be seen. But again, we do not have pools of resources like we have had through the pandemic to date in order to support those organizations in our regular budget year. Our childcare system, as I mentioned, is going through this transition and the build back to full utilization, and there will be gaps in terms of the support that we need to provide as that childcare system comes back online. Recreation, again, anyone's guess when we can get back to receiving the kinds of fees that we need to operate our recreation program. And Ontario Works, you know, in April of 2020, our caseload in Ontario Works was just over 12,000 households. In December, our caseload was 9,700 households. I'd love to be able to say that's solely the work of our staff in helping people to get back to jobs and everything else. Some of it is, but the other side of it is it's all of those income programs and all of those things that have kept people from needing to access social assistance. Well, those run out. And we expect by March and April, we will start to see an uptick. The question is, does it go back to our traditional level, which we can handle, or does it go beyond that? Something like in the last recession, where we got up to 14, 15,000 households on social assistance, which will create some pressures. So we continue to look at all of these issues around affordability, around childcare. And, I come today with a lot of I don't knows, but I come today also to let you know that these are the kinds of things that we will together have to deal with as we move through this pandemic and transition out of this pandemic at some point in the future. We have done everything we can to try and reduce the impact of the pandemic from a human services perspective on the municipal budget. We have been greatly supported by senior levels of government who have been fantastic. And I am seeing what we could be able to do if our homelessness budget, for instance, was just doubled each year from 20 million to 40 million, because essentially that's what happened in 2020. But I don't know that that's what the sustainable idea is of the province. If it is pulled back to our traditional levels, we will still struggle with how we support people in situations of homelessness with new and creative programs. I've seen what can happen from a housing construction perspective when it's 100% funding and we don't need to cost share things along the way. The Rapid Housing Initiative being a great example of that. Will those be the way that government continues to invest in housing, or will it go back to an old model where we need to again find new municipal resources to move forward on housing? We've maximized all of our subsidies. We reviewed a number of things in order to ensure that we can move forward in a positive way with the least impact to our taxpayers. But how long that lasts will depend on how long we have this tremendous partnership with the province and the federal government in terms of their investments. We have one business case before you this year, and it is a business case you've seen for a number of years now. And that is that we are recommending an additional investment of one ambulance and the staff that's required to support that ambulance to keep up with the call volumes in this community. I'll go back to two things that you've seen already. Our call volumes are increased. We have not gone back to where we are. We are significantly above where we are and struggling to keep up with the resources that we have on the road. The second piece is just a reminder that of 19 other municipalities of more than 100,000, we still have, from a call demand perspective, a much higher call demand than the average, and we are providing fewer unit hours per 100,000 or per thousand than other communities. And again, the goal of this is to maintain. It's not to fall further behind. This will not accelerate us. That would require 2 or 3 additional ambulances. This is to allow us to maintain our service delivery targets, our response time targets, and do the job that we need to do in our community. We hope to see the day where call volumes start to drop back, where we can see some of that relief, but we're just not there at this particular moment. So in summary, there are some council approved and referred items that we'll need to deal with. A couple of them have been approved, so they're already done and baked into the budget. And then of course, the women's shelter that we're so excited about does require some operating dollars, and we'll be interested to discuss that and answer any questions you have around that. But our advancement of the women's sector in terms of homelessness is an exciting move to take. The reality is, though, that it takes operating dollars for us to support that. And so with that, through the Deputy Mayor, thank you for listening and taking the time a little bit longer this year, because I wanted to cover some of our pandemic work. But we're really excited with what has happened in 2020 from both our response to coronavirus, but also the day-to-day activities in our department, and look forward to your questions and comments moving on now. And I will stop sharing at some point if I can figure out how to do that. There we go.
Thank you very much, Mr. Johnson. We have 2 speakers right now. We have Mayor Eisenberger and Councillor Ferguson. Mayor Eisenberger, are you there? Okay, so we'll come back to Mayor Eisenberger. Councillor Ferguson would be up next, please.
Yeah, thank you. I just want to make sure my audio is working. Is it, Mr. Chair?
Yes, it is. Can you hear
Thank you. And so, Paul, good presentation again. You know, you have a lot of skills in doing presentation, and that comes across every year. And even as you get more experience, and of course, the pandemic was a huge load on your group through 2020. And so congratulations on the great results. We still have a lot of questions out in the community about the vaccinations and the delays and what's that mean to us, but that's still work in progress, and that's probably for a future Board of Health meeting to ask you that question. But I just want to go back. You know, your hot one this year is ambulance, and it's up 7%. And I don't think I need to give you the speech that we have a lot of constituents who are unemployed, who are in the retail business or the hospitality business or the travel business, and they're saying you should be cutting taxes, not increasing taxes. But of course, the 7% for ambulances just jumps off the page. So either to you or the chief, how many ambulances have you been adding each year for the last 3 or 4 years? Because each ambulance is 10 people, 10 paramedics. And it seems like every year it's never enough. You keep coming back. So how many have we added, say, over the last 3 years?
Through Deputy Mayor, I'll let the chief take us back to the history of that. In the recent past, it's been 1 a year for a number of years, but there was also another period where I think some additional resources happened. So over to the chief for that answer.
Thank you. Chief?
Thank you. Through the Deputy Mayor, to the councillor, we've been adding basically 1 ambulance a year for the last several years. Certainly the first ambulance added was during my first year here with the service. We added an ambulance in 2013. And we've been continuing to add ambulances to catch up what was essentially a gap that had occurred back as far back as 2008. And that's also reflective of the actual ongoing call volume increase. I just remind council that we've been running an average of about a 4% increase in call demand every year for the last several years. That demand is not changing. And as General Manager Johnson's identified, the actual demand this year is continuing to go up. It's not going downwards.
So since you joined us, we've added 7 more ambulances or 70 more paramedics?
Through the Deputy Mayor, we've actually added from council approval, I believe it's 7 ambulances, and through the ministry funding for the neonatal intensive care unit that we're also funding, 100% funded from the province, another ambulance there, that would make 8, sir.
Okay, and each one has 10 ambulances. Because, you know, Chief, it's hard to push back as as laymen, as counselors are, on something like paramedic service. We have to rely on the expertise of you and Paul and others to guide us on this. But we have made significant investments over the last number of years, and is this really the right year to move on and have another 7% increase? And if I could just take you to slide 37 for a second. Over the past 5 or 6 years, the big issue for you when you're coming and asking for more ambulances is the offload time. I see nothing in today's presentation about offload time. And last year, Paul had a great demonstration showing that the TV units that are in the emergency rooms, so it's in front of everybody, how many code zeros we're at, and and allow you to see on screen, or Paul to see on screen, and others where the hotspots are and take corrective action on that. Has offload problems been fixed?
Through the Deputy Mayor, offload problems were fixed for a very short time frame. We had significant reductions in hospital offload delays, particularly in the March through September time frame. They have continued to increase since that time. We're currently encountering sometimes as long as 8-hour offload delays at hospital. Not unusual. We're finding the same things happening across the province as hospitals are jammed in their capacity and their ability to flow patients through. So in answer to the question for the councillor, offload delays were reduced. They're going back up into normal situations. I can tell you, just for an example, yesterday our 90th percentile offload time was 160 minutes. So that's almost 3 hours at the 90th percentile. So those continue to be a challenge. With respect to the Code Zero events, we had the same experience with Code Zero events. For the year of 2020, we had 27 in total Code Zero events. That compares to 80 in 2019, and to me, that's a significant improvement. I'm sure it is to everybody in the process. I can tell you that 15 of those were in the first 2 months of 2020. That's the January-February time period prior to the major part of COVID and the implementations that we've had. We had, for a 7-month period, 1 or less Code Zeros in each month. The Code Zero events are starting to go up. We've already had 3 this month so far.
I recall, Chief, when you first started this program to add more ambulances because of the offload, and we were lobbying the province to put offload nurses in emergency rooms, you were over 200. And if my memory serves me right. So that is a huge improvement down to what you are right now. Would you agree with that, or have I got my numbers right?
Through the Deputy Mayor, the numbers are correct. I remember when I first came to the service here in Hamilton, we had a number of 242 Code Zeros during the year. That is not just, I would identify, a result of hospital offload delays. That's also a result of the pressures in terms of ambulance call volumes. So it's not just about the hospitals, it's also dealing with the call volumes and the activities. We don't get to control that part of it.
Okay, I was surprised or interested in slide 37. And by the way, it'd be nice to see the Code Zeros. You always had that right in front of us every year, and I don't see it this year. And because it's a good news story, and there's nothing wrong with giving us a good news story once in a while at budget time. But if I look at slide 37, transport to hospitals are down 20% from March to May, and then after that, it says post May 22nd. So I guess that's May